move on to Dr. Ismail Badjie, who is the CEO and founder of Innovarx. Now, most often the time when people talk about the healthcare system in the Gambia, you know, the next phrase that pops out from everyone else's mouth is, there is room for massive improvement. We are so much used to, you know, having the basic stuff, more like an analog sort of healthcare system. And what you are introducing is like taking healthcare access, you know, to another level, and most importantly, using IT, which is a digital platform. Can you tell us how this is going to work in a community, you know, like the Gambia, and how it is also going to ensure that the healthcare sector in this country is actually improved?
Yeah. Good afternoon. I'll start off by thanking Uncle Taf first and congratulating you for 30 years of excellence. I think it's important when we could realize that Gambian excellence could be great in the Gambia, but it also could be exported. I think Gambia as a company, as a country, we've done a tremendous job exporting our excellence. This room is full of Gambian sons and daughters who are excellent in their own right, that the world has benefited from. So I just wanted to start there as well. So thank you for the platform, Uncle Taf. The subject matter is about creativity. I believe that creativity is God's gift to mankind. I believe there's God in us all. And creativity is his way of proving that he created a perfect being. So even if it's Uncle Taf visualizing a new development, God put that level of creativity in him. So I think it's very, very important to understand that every single person in this room, irrespective of what field you work in, God is in you. And how you create, how you make the world better, is God speaking his magnificence through us. So I think it's very, very important. So Innovarx Global Health is a healthcare solutions company that we just started in the Gambia. It's really, really important to always emphasize that when we talk about the healthcare system. Let me start by the human element of technology, because my background is not in technology. So for the past 10 years, I've been practicing as a healthcare professional in the US. But I tell people I have 3 hats now. I have 1 hat as a healthcare professional, because I'm trained as a doctor of pharmacy. I have a new hat as an entrepreneur, and I have a hat as a human being. So by raise of hands, how many people have used WhatsApp in the past 24 hours? Almost everybody, right? So sorry, let me scoot up a little bit. I like using WhatsApp as an example of what technology has done for our humanity as African people. Could you picture a 70-year-old grandmother in the Gambia using WhatsApp now, where they don't have to worry about whether they speak English, they know how to write English? The technology is created where you could hold on to a button and speak any language in the world, and you know that the person receiving that, on the other hand, understands you. Technology restores our dignity as a human being, our dignity as an African people. So even though I'm not trained in technology, healthcare cannot exist without technology in 2020, which is why Innovarx Global Health, as a healthcare solutions company, yes, we have the experience in the US, but one of the things I battled with working in the US was, you know what? We like nice things too. We deserve nice things too. Right? As an African continent, as a Gambian country, if there's a medication that is not good enough to sell in the US, it should not be good enough to sell in the Gambia. Right? The fact, I'm going to put my hat on as a healthcare professional now, as a pharmacist, the Gambian people are not living to be long enough. The average Gambian man is only living to be 63 years old. So if you're a Gambian and you're 30 years old, half of your life from a life expectancy, it's gone. So if you peel layers of the problems, healthcare is at the root of a serious nation that wants to move forward, and it has to begin with creating solutions, which is why when we formed Innovarx Global Health, we did not focus on problems. We formed it as a healthcare solution company, knowing one, technology exists to make healthcare more affordable. Two, we know what we don't know, meaning we're entering a new ecosystem that we've had giants in the industry, in the healthcare. We have some here, Dr. Salas here, Dr. Ramunjai. There's a lot of doctors who've contributed significantly to the health ecosystem. How do could we build on what they've already added on top of, just to move the healthcare solutions company forward, right? So in terms of technology, one of the things I'm excited about is we build a concept around how do you improve access using technology. I use a story of what our telemedicine service is doing now. So we've launched our company now and we're offering telemedicine services. We had a gentleman who had his kidneys failing. The Gambia doesn't have a lot of nephrologists in the Gambia, but the world does not lack nephrologists. So we have an instance where now a Gambian who does not have to apply for a visa, which brings it back to humanity, meaning he has to sit across from somebody who determines whether they are worthy to travel to get treatment. But now through technology, that gentleman could come to our facility. We could link him with a nephrologist at BLK, who is our super specialty hospital, and the consultation within 30 minutes, we could figure out if he needs a renal function test, we could do it at our facility. It takes 12 minutes. If he needs the electronic health records, we have an electronic health record system. So we've literally created a world with borders without boundaries using technology. So now, and I believe it goes back to restoring our capacity. It goes back to giving people the healthcare that we deserve. So telemedicine is one of those services that we're offering. But even speaking of electronic health record systems, I find it interesting because a lot of my colleagues in the United States always laugh when I tell them, hey, I am innovating, because it's a buzzword, right? But going to a pharmacy and leaving with a bottle that has your name on it is innovation only in the Gambia. They are not impressed when I tell them that, but it's important. Because now systems are in place where I believe we have the technology and we're engaging all stakeholders to link the entire Gambia under one electronic health record system. So in meaning, even if you're unconscious and you have a unique medical record number, you could go to the hospital and they could find out what your blood group is. You could go to Serekunda Hospital and get a hemoglobin test, and I am at home, pull out my cell phone, and I could see what your result is. So if a doctor has to consult, you are just closing the gap. That's what technology can do, and that's the technology that we have readily available to make the Gambia a better health ecosystem. We know access is always a problem. We launched a service called Wellness on Wheels. Wow. It's designed, it's near and dear to my heart because most of the times when you look at our community, most of the elderly people have ailments. Most of the elderly people have mobility issues. Our version of what taking care of our elders is literally they're at home. So if they have issues, how could we create a health system where now healthcare is brought to them? Meaning grandmother could be on her bedside, she's diabetic, she needs her blood glucose monitored. It's 2020, she should not get up, get ready, go to a hospital, buy a ticket, stand in line for 2 hours while fasting just to check her blood glucose level. She should be able to wake up, be bedside, and our company come to her using electronic health record systems, check her blood glucose, and even if her doctor is in Japan, the doctor should know that, hey, grandmother is doing okay today. That's the health ecosystem that we believe we can create, and it's moved from being an idea stage to now we're actually implementing it, and it gives me hope, knowing that these services are in place, which is why one of the first things that we did as a company is find out we try to reach out to almost every single healthcare provider in the Gambia, and we still have a lot to do. Because part of being an entrepreneur, let me put my entrepreneur hat being on, startups is tricky. Technology is tricky. Being an entrepreneur, most entrepreneurs fail. Most businesses fail. Which is why when we celebrate TAF at 30 years, TAF is a unicorn in the entrepreneur space. Most businesses don't last that long. But I think part of it too is my mother, who's my entrepreneur role model, and my sister as well too, she always tells me this wall of proverb. Ne nit bala nga ham fu sa wërsak tollu, nga liggéeyal sa boppa. Right? I like extending that as a collective nation. Bala ñoo xam fu suñu wërsak tollu, ñu ngi liggéeyal suñu boppa. Right? And I try not to be political. Because I think I'm in a tricky space as well too as a new entrepreneur. We've had a lot of discussions about the role of government and how businesses move. I find it confusing sometimes because when people say the government, I'm a little bit confused. Because the government is the people. The government is a representation of Gambian people. We've had new presidents, we've had new leaders. The government will always be a reflection of who we are as a people. And if we collectively say that we want better across all systems, healthcare, technology, we have to be better as people, right? So yes, we need government support, especially in terms of pushing the best of what we had offer. But I think even the word catalyst is used a lot. Catalyst for change. I did my first degree in chemistry, so I'll go a little bit nerdy, right? So a catalyst from a chemical reaction standpoint is something that could speed up a process without changing its original form. Meaning if government has to be a catalyst, if our private stakeholders have to be catalysts for change in any industry, they should be able to speed up the process while remaining the same, and remaining the same meaning irrespective of who it is, whatever is better should move forward. That's the hope that we want to have in terms of support. But to bring it back with the concept of healthcare delivery, I'm excited for what technology can do for us. My background is not in technology. I look forward to a day where Gambia could be in one electronic health record system. I am challenging every single person in our industry because I believe if we are serious, within 1 year, we could have a universal electronic health record system where every Gambian will have a medical record number. Everybody's blood group will be in one system. So if you need a donation, it doesn't take hours of logistics. You click one button and you know what blood group you are. That's the vision that we want to paint for the Gambia. Right? And that's where collaboration will also come into play. I see Point Click is here, Malik Khan's company. They do cloud-based services. We're running a cloud-based electronic health record system, right? A lot of people will tell you, well, Gambia is not ready. Gambians are using WhatsApp, social media all over Gambia. So a lot of these systems in terms of healthcare and technology, it's not reinventing the wheel. It's using technologies that already exist. Even telemedicine, when I tell people telemedicine, it sounds like a fancy word, right? If a doctor is in Japan, a patient is in Gambia, they have FaceTime. They have an electronic health record system that's cloud-based. Ladies and gentlemen, that's what telemedicine is. A consultation that you use technology that already exists, you just intertwine healthcare to it. So now for people in the diaspora, which we know Gambia is sustained by diaspora money, it's over $200 million that comes from outside that comes in, right? So I'm always wary when they say it's a joint effort. We're a tax economy, but we're a diaspora economy. We built our company where now it's cheaper than a plane ticket. If your loved one has diabetes, hypertension, high cholesterol, I keep on mentioning these diseases because more Gambians are dying from these non-communicable diseases than malaria, right? They really are. And it's not an old man's disease, right? I always like to tell people I am 34 years old, considered youthful, but I'm also 34 years old and I'm hypertensive, meaning I have high blood pressure because it's genetic to it. So sensitization and using technology, using preventative services is the Gambia we have to create. So which is why my company is just in the business of finding solutions, because I think 2020 has to be an era where there's an intellectual rebellion in a sense that we have to act now. So our company is just positioned to, one, leverage technology just to see how we could level the playing field where now a grandmother in Mansakonka could have the same access to quality care than a grandmother in New York, in Tokyo, in Stockholm. That's just the vision that we want to create. And I think that technology allows us to do that. The distributions that we have with quality medications allows us to do that. And it's just a matter of how we can leverage it, not only for a Gambia thing, but throughout the whole sub-region as well. Thank you.
Thank you.
Thank you. Thank you for the opportunity. Okay. Thank you for the opportunity, Abdullahi. My question, which is the first one, goes to Dr. Ismail Badjie. I congratulate you for the presentation, first of all. Looking at your presentation, you know, you're talking about electricity, you're talking about the internet. In this country, electricity is erratic, internet is epileptic. So under these circumstances, what do we do with the technology that you talked about?
Yeah, I think that's a really important question, because that's one of the things we grapple with in the beginning stage, because we knew, one, our product was maybe years ahead of the infrastructure that's in place, but that's how we should be thinking in terms of innovation, because if we establish it now, I'd much rather, if light is out, write it on a manual paper, and then when light's back, transpose it into an electronic record that's more permanent, than saying that maybe light is going to be an issue. Maybe we should still stick to paper records, and then a fire happens, like it happened in our ministry, right? And then all the records are gone. And I think we shouldn't underestimate what data availability has done for Gambia. Gambia all of a sudden went so digital in terms of access to internet that we still want it to be cheaper, yes, but across all sectors, socially we've benefited from technology, but we're not leveraging technology in a more productive way, meaning things like electronic health record systems, meaning cloud-based internet services, not internet, email services, where all government platforms have their own email system that's cloud-based, where now our officials are not at foreign meetings, and then their cards have a Gmail or a Hotmail account, right? So I think that's a concern, but we want to be ready for when those systems improve, we don't have to reinvent the wheel. So even now at our facility, we have a backup manual system for when the internet there's interruptions in internet, but as soon as it comes back to regulation, then we just transpose it into electronic record, because I think that's most important too for patients when you have to travel. Because how many people have their medical records from last year? It's very difficult, right? But if it's an electronic copy and you want to go to an interview, or your child is going for studies, all you have to do is call the facility. I need a soft copy of the physical from last year. Or from an accountability standpoint as well too, which I think the diaspora is really important. If you're sending $200 every single month and your mother is telling you that I'm buying medications for diabetes, or I'm getting my blood sugar checked, there's no way of checking. So even accountability in the system too. If I'm a pharmacist, I want every single consumer to be able to hold me accountable for what medication I sold, when I sold it, why I sold it. So even if it's an antibiotic that I just walk in and want to purchase, if I did not see a doctor for that antibiotic, I should be in a position to tell the patient no. And if there's an electronic record, then it makes it just easy for accountability and transparency to be in the system. So infrastructure is always a challenge. And I think as a startup, one of our biggest costs was creating backup systems. So backup electricity, backup internet. So we have Gamtel and Africell. We have a generator instead of NAWIC. So there's a lot of, it increases the cost of doing business. So as the systems improve, which I think they are improving, our costs will go down, but the technology already exists. And I think it's really important when we're innovating, especially in Africa, we shouldn't bring something that's an Africa version to Africa. The benefit of the diaspora being in systems where we've integrated into systems in the Western world, we know the systems, we know what's good of it. So when we're innovating in our country, we actually have a better advantage to create a system that does not exist there. Right? So even with our company, I tell people a lot of times, yes, I used to work for Walgreens, which is a giant, but we're doing things in terms of service where now, even if I'm at Broadfoot, I could call the pharmacy, tell them I have a cold. They'll tell me, okay, 1 second, let me have you speak to the pharmacist, and they could recommend a product and deliver it to Broadfoot. There's systems in Europe that are not doing those things in terms of a quality care, so it's actually creating a model that's better than what's out there, because we've been behind for so long, so if we're trying to catch up, let's create systems where in 2023, 2024, 2030, we don't have to reinvent the wheel. So it's just things that we have to consider.
Thank you. Thank you very much.
Hi. Thank you very much. That was really, really great from all of you. And it's really brought such joy to my heart, because we are very good at identifying problems. And I see that you're all solutions driven, and I think that's the way to go, because when people come to me with problems, I say, please, for every problem you bring, can you think of at least 3 solutions? And if we all do that, I think we'll be much further ahead. So I'm just going to pick up from my sister about the power supply. And I have seen some projects that are going in the country where they're using solar for a lot of things. And I wanted to ask Mr. Ataya whether there's a solar version of the e-brother that you can use maybe in Basse or Medina Samako, where you don't have access to electricity. Because I've visited a project where the solar was very much. But one thing I want to talk to you, I want to commend Dr. Ismail Badjie about is his collaborations. Yeah. Everything you want to do, you can do it. And also, if I see a patient and I don't have time, I can just press a button and dictate what I want to dictate, and it's speech recognition, it's in text, and then I can send it to any doctor or the patient themselves. So I think that for us, technology has the capacity to help us to leapfrog into the future. Honestly, because when I tell you how lack of electronic medical records has adversely affected patient care and patient outcomes in this country, we have to move to digital records. I think virtual reality has the capacity to do a lot. We have one radiologist, one Gambian radiologist in the whole country. Now, this is a general radiologist. Think about cancer care. It's just been shown that artificial AI and machine learning can diagnose breast cancer from mammograms better than human eyes. So if you take a mammogram, a digital mammogram, you can send it anywhere, get results, be able to treat that patient without delay, which is important for cancer care. So, I mean, you've been inspiring, and I thank you for what you're doing. We should all support you, actually.
Thank you.
Of the West African Postgraduate Training College, that is the College of Physicians and College of Surgeons. Whilst Liberia and Sierra Leone were able to capitalize on this status and mobilize funding from World Bank that was administered through WHO. We could have done the same, but we were just too sleepy to do that. And because of that, we are lagging behind. And it's now showing in the results. I came from the College of Physicians meeting recently, while some of those countries that were even behind us before are now graduating doctors at senior level in their numbers. Gambia had only a single candidate who was not even trained here. So we definitely have a long way to go, and we need to be more serious about healthcare issues and delivery. And I have a problem with the Gambians' attitude towards health itself and healthcare delivery. It has to change.
Thank you very much, Dr. Salah. Perhaps maybe back to Dr. Badjie, but if you can just summarize in a minute or two.
I'll definitely make him brief, and I'm glad Dr. Salas spoke, because he's one of the giants who's been in the industry for a while. And Dr. Ramunja will tell you, as an entrepreneur, I'm very, very sensitive about also healthcare professionals practicing within the scope of their practice, meaning every single doctor, you have a role based on your training. So I'll never be in a position as a doctor or pharmacist to try to diagnose somebody. So I think a lot of sensitization has to happen in our communities as well too, to know that each doctor is not trained to do everything. So when he speaks to the shortage of doctors, it creates an ecosystem in the Gambia where, and I struggle with this sometimes, where they see Dr. Ismail Badjie and they tell me all their medical problems. And I have to be responsible enough to tell them, no. You go to a general practitioner first to give you an accurate diagnosis, and then when he starts to try to put you on medications, that's when you come to me as a doctor of pharmacy, and I could tell you what to do. But it speaks to the shortage of healthcare professionals that we have, which is also why we have to leverage technology. So now, if there's an ecosystem in the Gambia where there's nurse practitioners in the US, there's nurse practitioners in the UK, who are not ready to make that bold step of coming back home, because it is hard to come back home. That's just the reality. We want people to come back home, but sometimes it takes a level of sacrifice that we don't do it to get a pat on the back, but it's a huge toll on us, on our families. But you could leverage technology where now, even if a doctor in Sweden wants to sacrifice 10 hours of their week to see Gambian patients, telemedicine allows that opportunity to do that. So we have to be willing to see technology as our friend and not something that will also disrupt the current ecosystem, because we struggle too, right, when we're coming in, it goes back to us as a people. Sometimes instead of collaborating, we want to compete first. In the pharmacy industry, for example, I think it took us 5 years to get established because it took that long. Not because we didn't qualify, not because we didn't want to bring services back home, because there are also systems in place where there's a lot of conflicts of interest in industries that we also have to address head on. As a professional person who has a license in the US to practice, I don't think a pharmacy license should be rented out as a commodity. In the Gambia, that is happening. So if a non-person not trained to handle pharmacy, that's why you can't walk into a Gambian pharmacy and see a pharmacist. And it's difficult if I speak up on it because it puts a bullseye on me. But that's the reality that we have to attack head on, meaning people deserve to see the healthcare professionals who are licensed. They take a Hippocratic oath to take care of humanity. We also have to be in a position to enforce it. That's the only way our health system could be better. We have to create a responsible system.
Thank you very much, Dr. Badjie.
Good afternoon. My name is Dudu Lamin Samba. I'm an IT professional as well, and I work in the United Kingdom. I have a quick question for Mansata and Ismaila. Dr. Badjie, what security measures do you have in place to protect your patients' personal data in regards to your applications?
Yeah, sure, I'll go first. So what we currently do is therapy. So as we go, there isn't any data we collect, given our first prototype, this is our first product. Going forward, we will be using artificial intelligence where we will be collating data. And because I am based in the UK, we have GDPR, I'm sure you know, so I think I'm sorted. So they have grand rules around data, so which you have to, you're fined if you don't follow. So data shouldn't be an issue for me. I think the main challenges for me would be integrating what I already created in the UK back here in the economy, in the Gambia, and just trying to, as Doctor said, explain the benefits of having such advanced technologies in terms of the application, not just in the mental health space, in the pain medicine space, in helping with phobias, in helping with even childbirth now. There are trials going on where women don't feel pain in VR when they're giving birth to. So that's the power of VR, and that's what I want to bring back in the Gambia.
Thank you very much.
I think
Dr. Badjie, in 1 minute?
1 minute. So yes, so the benefit of us being a US company is we built our privacy practices based on the US, which is more stringent. So even at our facility, if you come for a screening, you have to sign a consent form. So meaning, even if your husband, you don't give us consent to share your results with your husband cannot have access to your records. That's one aspect of it. There's a level of confidentiality, which is why we're rolling out therapy services for mental health, which is why we do STD testing, because all those records, I feel like we need to give the agency back into the people that it belongs to from a privacy standpoint. And from a cloud-based standpoint, a lot of people are hesitant to go cloud-based because they tell you, what about privacy, what about data? And Malik could attest to that because he runs a cloud-based service. Nobody protects data more than these giant companies like Amazon, Google, right, and the like. So everybody in the room with an email, Yahoo, you're using a cloud-based services. So the data is already protected from that perspective. But patient confidentiality is the bedrock of our practice.
We are discussing this because today I want to ask you, if you are looking for an employee in your organization or anybody else here, to find an employee that is competent, capable, able to be a billable employee on day one, it is very hard. So what we need here is what we call capacity building. We need to educate our folks in technology. And what I meant by that is most of the folks, when you give them the laptop, most of them don't know what to do. It is a fact. I have seen it. I have lived it. So have you find it very difficult to find a really, really talented IT skilled folks? If you want to bring a call center here in the Gambia today to look for 400 Gambians who can do technical support in system administration or network administration, are we able to find this?
Thank you, Mr. Ba. I think the question is clear. Dr. Badjie, again, 1 minute.
Yeah, I think capacity is a challenge with any startup. And what it does is it increases your startup costs because you have to outsource a lot of the labor. But I also tell people, when we were starting the company, we did not know that Asutech existed. So they are Gambians who are equally qualified to do a lot of the skills. So we outsourced the building of our mobile application, and it's almost done. And then I met Asan. I knew about Asutech. So at that point, it's a no-brainer to transition the sustainability of that app to a Gambian-owned company, right? So plenty of times, capacity is a problem in any field, but we also have to be intentional. When we import talent, we make sure that that talent is transferred to a Gambian who could sustain it, and we also have to be willing to now hand over the project to a fellow Gambian, where now somebody else who's not Gambian cannot technically bribe their way through getting something that a Gambian deserves.
Right.
So especially in the tech space, there's Gambians, there's a hackathon tomorrow. There's Gambians doing amazing things. If we're intentional about finding it, it'll make your startup costs higher in the beginning, but you could train, we've trained nurses on point of care technology diagnostics that they've never used it. There's doctors in the ecosystem that have never worked with an electronic health record system. It'll be intensive in the beginning, but if we're intentional, Gambians are capable. We just have to be willing to empower them.
Thank you.